everybody. We're going to go ahead and start and kick things off. It's noon, so thank you everyone for joining us today. This is the Arizona Climate and Health Summit for Health Professionals. We're so excited that you're here, and hopefully you're going to have a good session today. Next slide. We're recording this first part of the session, so if you want to watch Dr. Collins talk later, you can do that or share it with other people. Next slide. So my name is Brian Drummond. I'm an emergency physician here in Tucson and the co-chair of the Arizona Health Professionals for Climate Action. And so we're just excited you're here. We're going to have you, next slide. Go ahead and put your name in the chat, maybe what role or organization that you're part of. Maybe you're just a worker bee, that's okay. Go ahead and put that. And then what part of Arizona you're in. This way people can see where people are coming from and kind of start to put names to faces and organizations that may be a part of this summit today. Next slide. So here's our goals for today that we're going to kind of talk about. In a sense, what we're trying to do is climate change and patient and population health is affected and interrelated. The hard part is, this wasn't a formal education part for any of us, and it just kind of is now becoming more prominent and we're taking more notice. So we're trying to bridge kind of that educational gap that people have, but also then communicate and advocate, not just for our patients, but for our communities around the state of Arizona. So the goal of this event is trying to put some different organizations and people from around the state together, but also to offer some educational opportunities here, learning about carbon output in the healthcare industry as well. And so we're going to have a little education component today, and then we're going to get into kind of some brainstorming work groups later on and talk about what people's interests are, what people want to see, and then how we can all interact together to kind of make this stuff happen. And then going about what we can do and what we can take from this. Next slide. So how does this kind of fit into the mission? This is kind of our coming out party as the Arizona Health Professionals for Climate Action. We are a state chapter of the Medical Society Consortium of Specialties, and they're kind of a bunch of medical specialties together that are trying to work on climate change. And so we're associated but different, but focusing here on the state of Arizona. So part of our mission that we've looked at, and we've been kind of in the steering committee phase for the last year, is trying to figure out how we can best help people reach these goals. And one of the big aspects we talked is that amongst ourselves was that education on these topics helps lead to us become better advocates. It's hard to advocate for something if you don't understand it or you don't feel comfortable about the topic. So we really want to draw that educational component of how climate change is impacting patient community health. And then also why we need to act now. Why is this so important? So that's kind of the educational component, that if we can reach people in Arizona with that, they can become more effective advocates. And when we're advocating for climate solutions, adaptation is one part of it. And adaptation is, okay, yes, it's hot. How do we make it easier for our patients and community if it's hot, or how do we avoid the smoky weather? That's one aspect for the immediate today, but what we really want to work on is decreasing those greenhouse gases, drawing down the carbon dioxide that is causing those events. And that's kind of the talk today that we're going to be doing, is talking about the decarbonization of healthcare. So one aspect of what we're doing. So that's kind of what we're looking at is our mission, and hopefully this is an introduction for that, and you were interested in joining what we're doing. So at this point, I'm going to turn it over to Rhonda Seifert, my co-chair, and I'll let her introduce our guest speaker.
Thank you, Brian. Yes, so I am Rhonda Seifert, co-chair, and next slide. I want to thank the Medical Society Consortium on Climate and Health, our state affiliate, Arizona Health Professionals for Climate Action members, especially our steering committee, and also University of Arizona's Arizona Climate and Health team and Maricopa County Public Health for helping to plan and get the word out about this event in a very short amount of time. And Dr. Collins, while I do your introduction, please feel free to set up your presentation sharing. So I want to thank all of you for making time today for this critical public health challenge. Like many of you, I'm excited to learn more about how we as health professionals can make a difference in the health and well-being of our communities. And our speaker today, Dr. Amy Collins, is an emergency physician in the Boston suburbs and a sustainable healthcare professional. She founded the Sustainability Committee at Metro West Medical Center in 2007 and led the sustainability efforts there for 7 years. Under her leadership, Metro West Medical Center received numerous environmental excellence awards from Practice Green Health, including the Environmental Leaders Circle Award, the most prestigious award offered. She also worked as a sustainable healthcare consultant for Vanguard Health Systems and implemented sustainability programs at Vanguard's 26 hospitals nationwide. She now serves as the medical director for physicians engagement and education at Healthcare Without Harm, leading their physician network with a goal to support physicians and medical students who are interested in promoting environmentally responsible, climate-smart healthcare and other climate solutions. She speaks internationally about the intersection between climate change, health, and healthcare, and the role of the healthcare sector in leading climate solutions. Thank you for being with us today, Dr. Collins.
Thank you so much for that lovely introduction, and thanks again for the invitation to speak with all of you. Looking at all those beautiful pictures of Arizona in your backgrounds, I wish I could be there with you in person, as it's currently very chilly and raw here in Boston. So I'm going to start by sharing a story. My story started back in 2007. I was in the school pickup line waiting to pick up my 4th grade son. I was idling and texting and listening to music, and he came out to the car from the school, opened the door, and immediately reprimanded me about idling. He told me that his teacher had read him a story that day about climate change and the impact it was having on polar bears, and he never wanted to see me idle again, and he wanted me to take action on climate. I agreed to do that. We crossed pinky swore, which was what we did when I made an agreement to do something. And the truth was, I didn't know much of anything about climate change. My only point of reference was the Al Gore documentary, An Inconvenient Truth. So since I had made a promise to my son, that night as a family, we watched the documentary. And as a family, we just were riveted, and we vowed to do what we could in our home. We did energy efficiency audits, reduced waste, planted a backyard garden, started drying our clothes in the backyard, whatever we could do to do our part. And then it became very uncomfortable living one way at home and another way at work. And I started to wonder why I left my environmental conscious at the door when I walked in for a shift. I wondered why at 7 o'clock in the morning when I walked in and there were no patients in the department, all the lights were on with TVs on in many rooms. I started noticing all the waste and inefficiencies, and it led me to ask someone if I could start a recycling program. Excuse me, and I was told that recycling was illegal in a hospital. I was not satisfied with that answer, so I went to Google and typed in hospitals and recycling, and I came across Healthcare Without Harm, the organization I now work from. I learned that not only was recycling not illegal in healthcare, but that healthcare had an enormous environmental and climate footprint, and there were many solutions to reduce that impact. So I got educated, and I wrote an email to my administrative team asking for permission to start a recycling program and a sustainability committee. And I was given permission by email in about a half an hour. I fully recognize that it's not usually that quick or easy, but in my case, it was the right ask of the right administrator at the right time. So I was given permission to lead the sustainability efforts. I did that through putting together a director level sustainability team. It was without a doubt the highlight of my career. It was the most fun, impactful, rewarding work I've ever done. We reduced energy and waste, transitioned to safer, cleaner products, a lot of initiatives in the OR, lots of healthy food programs, partnering with local farms, and a lot of employee community engagement, and we saved a bunch of money. Our efforts led us to win the Environmental Leadership Circle Award 2 years in a row, which is the highest award offered by Practice Green Health. I no longer do that. I now work for Healthcare Without Harm, which is a global organization founded right here in Boston in the late 1990s. We are a worldwide organization, and our mission is to transform healthcare worldwide so that it reduces its environmental footprint, becomes a community anchor for sustainability, and a leader in the global movement for environmental health and justice. We have branches in 4 continents, and our reach is over 44,000 hospitals and health centers in over 72 countries. We have many program areas, waste, energy, buildings, transportation, water, greening the OR, healthy food. However, our current priority is climate smart healthcare, which is our term for sustainable healthcare. Our initial campaign we actually had 2 initial campaigns. The first one was to close down medical waste incinerators. At that time, we learned that medical waste incinerators were responsible for dioxin and mercury pollution, and there were many on site. Through partnerships and collaboration, we led a successful campaign to close down hospital-based medical waste incinerators. And our next campaign was to eliminate mercury from the U.S. healthcare and pharmaceutical sector. Many of you are probably too young to know that we used to have a lot of mercury in healthcare, in our thermometers and blood pressure devices. Mercury is a potent neurotoxin, and the healthcare sector was responsible for mercury pollution. That campaign started with the return of 1 mercury-containing thermometer at Beth Israel Deaconess in Boston, and led to a successful campaign to virtually eliminate mercury from U.S. healthcare facilities and pharmaceutical stores like CVS, and it ultimately culminated in a global treaty agreeing to phase out mercury from the global healthcare sector. Our work has come a long way. We've had a lot of successes, but again, our current focus is on climate smart healthcare. So why are we focused on climate smart healthcare? These are my reasons, my messages that I use in my communications whenever I speak to anyone about climate and climate smart healthcare, and in written communications. And this is the framework of my talk. One is that we are running out of time. Climate change is a global public health threat. Extreme weather events can impact healthcare delivery, access, and supply chains. The healthcare sector contributes to the climate crisis, actually makes a sizable contribution. And we know that health professionals are trusted and can be very powerful advocates for climate solutions at many levels. So in this talk, I'm going to go through some of those talking points, but I wanted to start with some grounding and get you familiar with some language, where we are and where we need to be. I'm sure you're all familiar with the 2015 Paris Climate Agreement, and that the goal is to limit average global temperature rise to well below 2 degrees Celsius above pre-industrial levels, ideally limit the increase to 1.5 degrees Celsius. What I want you to know about that is what we need to do to reach that goal is we need to have greenhouse gas emissions by 2030. So in the next 7 years, we need to reduce emissions by 50%, and we need to achieve net zero emissions by 2050. So we are not on track to reach this goal. The IPCC report, which came out last November, was referred to as a code red to humanity, issued a stark warning that we really needed to take action. And that was again reiterated in this technical report, which came out last spring. And I just want to draw your attention to, a few things from this report. One is that without immediate and deep emission reductions across all sectors, it'll be impossible. Note all sectors is in bold. That includes the healthcare sector. The healthcare sector does not get a pass. We have the tools and know-how required to limit warming, and we have options in all sectors to at least have emissions by 2030, and that includes in the healthcare sector. It's not that the tools and resources and know-how are missing. It's that there's a lack of awareness and prioritization and knowledge how to actually decarbonize. So I'm just going to briefly mention, climate change is a global public health threat. I think you probably all know that. It's been referred to as the biggest global health threat of the 21st century. That was stated again by the World Health Organization last year. Climate change has broad adverse effects on health. Sharing a CDC graphic, which I'm sure many of you are familiar with, outlining the various pathways through which climate can have negative impacts on health. Health impacts vary by geographical location. So the impacts that the patient's eye see might be different than the health impacts that are being experienced by people and communities in Arizona, and the health impacts are disproportionately felt by the most vulnerable and disadvantaged, women, children, disabled people, outdoor workers, children, and other vulnerable populations. I think it's also worth noting, and in your communications, to communicate that the global health and medical community is united in its concern about the health impacts of climate and the need to urgently reduce greenhouse gas emissions to protect health. Sharing a editorial and opinion piece that was published last year, simultaneously on Labor Day of 2021 by more than 200 health and medical journals calling for urgent action on the climate crisis. So now I'm going to talk about extreme weather and the intersection between health and healthcare. I think you probably all know that extreme weather events are increasing in severity and frequency. The recent hurricane in Florida, the wildfires in the Northwest, heat waves. 2020 was actually a record-breaking year for what are called billion-dollar weather and climate disasters. So these are weather disasters, and each one causes over $1 billion in damages, and that's not including the health costs. And this was a record-breaking year. 2021 was also a record-breaking year, and 2022 is on track to be a record-breaking year. And you can see that these extreme weather events vary from extreme flooding to extreme snow to extreme heat to wildfires, and can vary by geographic region. So these extreme weather events can actually, absolutely have adverse impacts on health, through injury, illness, death, and mental health impacts. But I'm primarily going to focus on how these extreme weather events impact healthcare infrastructure and our ability to provide care. I'm going to share a little case study from NYU Langone, which is where I went to medical school. In 2012, Superstorm Sandy hit the Northeast. NYU Langone is on the East River. There was significant rain and a 14-foot storm surge. The medical facility was not built to withstand a surge like that. There was sudden severe flooding with over 15 million gallons of water flooding the basements. And they lost their power, they lost generators, and it forced them to evacuate patients in the dark through stairwells at night and transport them to other hospitals, disrupting their care. This included, critically ill patients. And keep in mind that there were many other hospitals in New York at the same time doing the same thing. But the impact of this event did not end when the weather improved. There was significant infrastructure to NYU Langone. Their emergency department was closed for 18 months, in part due to renovations. There was a 2-month suspension of surgery. It ultimately led to over 500 NYU providers seeking privileges at other facilities. And as you can see, the institution took a big financial hit. So the takeaway is that, the business case for resilient healthcare is strong. It pays to be prepared and to invest in resilience, to be able to stay open and operational during and after extreme weather events, to serve your communities, patients and staff. Extreme weather can also impact access to health care by disrupting utilities. Power may be out. Communication systems may be disrupted. In that case, people may not be able to, call 911 or call their doctor. And transportation systems can also be disrupted by flooding, trees down, wires down, making it a challenge to actually access healthcare. I share an image of an ambulance in Colorado that got caught in floodwaters during a patient transport, and a tweet that really struck me when I read it from Hurricane Michael in Florida a few years ago, where the only mode of communication they had at that time was via Twitter. So healthcare resilience really requires community partnerships and community resilience. Not only does the hospital need to stay open and operational, but communities need to be able to actually access the healthcare facilities and the healthcare they need. I'm going to share a little bit about an extreme weather event close to my home, which continues to impact patients I care for. Over 2 years ago, in June of 2020, there was a historic rainstorm, which caused, catastrophic sudden flooding, also often at night, in the community of Norwood. Norwood Hospital is at 215 beds, serving a community of 32,000 in surrounding communities. During this flood, they again had to evacuate patients at night, transport them to other hospitals. But the story doesn't stop then. This hospital is still not open. There is a plan to build and open sometime in 2024. But it has been significant for this community to lose all hospital beds. It's also been a challenge for the hospital to lose psych beds and also to lose beds during the COVID pandemic. The first I learned that this event may impact my patients is we learned that patients who were having STEMIs, which are heart attacks, myocardial infarctions, and needed to go to the cath lab to get an angioplasty, may be transported to our hospital because we were one of the closest facilities. So my hospital is Metro West Medical Center, Norwood Hospital. Norwood is down at the bottom. That's the community. When someone's having a heart attack, the goal is to get them to the hospital and to the cath lab as soon as possible. The saying is time is muscle. But as you can see, this was a screenshot taken not at rush hour, and you can see that it can take up to 39 minutes to get from the Norwood community to my hospital at the cath lab. So this presented a significant delay in access to care and the intervention that was needed, and also took the EMS providers out of the community. I've continued to see patients from this hospital, which has been challenging as we're not able to access medical records, which is a standard part of patient care. And this event has also impacted colleagues. I have an emergency medicine colleague that was due to start as the director of this emergency department on July 1st. This event happened in late July. He suddenly found himself without a job, as did many others. We actually have a couple of surgeons who are currently moonlighting at my hospital, who were formerly affiliated with Norwood. They lost their practices, they lost their hospital and their operating rooms, and they actually refer to themselves as Norwood refugees. So these extreme weather events can hit close to home and can impact, patients, communities, EMS providers, and ability of healthcare providers to provide the care in the time, ideal time and resources. So extreme weather can also impact healthcare supply chains. Back in 2017, after Hurricane Maria, there was a significant shortage of normal saline IV fluid bags in the United States. That is because the two major manufacturing plants of these normal saline bags were in Puerto Rico and were destroyed during the hurricane, causing manufacturing and transport to stop. I recall getting the notice about this and being told we need to do alternate forms of hydrating people, such as give them Gatorade. And at that time, we also saw significant shortages of some pharmaceuticals, along with medical supplies and surgical devices, because the manufacturing plants were also located in Puerto Rico and destroyed. So extreme weather events far away can actually have impact closer to, right in your ability to provide care on a day-to-day basis. So now I'm going to turn to healthcare's climate footprint, which is really my passion. It's what got me, involved in this space, and it really is what drives me to do this work. I'm sharing information primarily from a research done by Jody Sherman, who is an anesthesiologist, and her research partner, Mac Eckelman from Northeastern University in Boston. This was research they published in 2018, finding that the healthcare sector is responsible for 8.5% of US greenhouse gas emissions and are the highest per capita in the world. From previous research, we knew that the US is the first in terms of healthcare greenhouse gas emissions, accounting for 27% of the global healthcare footprint, which is quite remarkable. They found that despite hospitals and the healthcare sector making efforts, emissions had risen 6% from 2012 to 2018 and resulted in public health harms on the same order of magnitude as harms caused by medical errors. So not only do healthcare activities generate emissions, but those emissions can cause public health harm. And the final bullet is really important to remember. In their research, and other research has also found this, that the majority of healthcare emissions are from scope 3, and we're going to talk about that in a bit, primarily from the supply chain, the procurement of food, pharmaceuticals, supplies, medical devices, and all the things that are purchased to run hospitals and healthcare facilities. So 8.5% might not sound like a lot. It's not a really big number. It may not sound that impressive, but in their research, they also found that if the US healthcare sector were ranked as a nation, it would rank 13th in the world for emissions, more than the entire UK. And I think that gives a good visual and a good understanding just how large the US healthcare sector's climate footprint is. So why does healthcare have, such a big climate impact? I mean, basically every single healthcare activity, from cooking to cleaning to performing surgeries to serving food, it generates waste and emissions. Hospitals are very energy intensive due to needs to, cool and light, and ventilate facilities and run equipment. They also are open 24/7. US hospitals generate about 14,000 tons of waste, including a lot of plastic waste, OR waste, food waste, waste from the OR. The OR generates about a third of hospitals' waste. Healthcare has a massive supply chain, as I think anyone who works in healthcare know. We have a lot of stuff. Healthcare has a big transportation footprint due to employee and patient commutes. Our healthcare's fleet vehicles, suppliers, and deliveries. We serve a lot of food. Sometimes hospitals are the largest restaurant in a community, serving many patient and staff meals a day. And our ORs are particularly energy, waste, and resource intensive. As I said, generating about 1/3 of a hospital's waste, about 2/3 of regulated medical waste. ORs also generate waste anesthetic gases. Anesthetic gases are administered, they're inhaled to anesthetize patients before, during surgery. They exhale the anesthetic gases, which are vented outside. And these anesthetic gases are actually greenhouse gases. The most potent, desflurane, is about 2,000 to 3,000 times more potent a greenhouse gas than carbon dioxide, and nitrous oxide is also another potent greenhouse gas. So seeing a significant movement for anesthesiologists to reduce the use of those two anesthetic gases. I think this visual gives you a nice idea of the scopes of greenhouse gases. The greenhouse gas scopes were determined by the Greenhouse Gas Protocol. Scope 1 are direct emissions that occur from sources that are controlled or owned by an organization, such as emissions generated from, combusting fossil fuels in boilers, furnaces, stoves. Note that they also include anesthetic gases. Anesthetic gases are direct emissions. Scope 2 are indirect emissions associated with the purchase of electricity, gas, steam, and oil. And scope 3 are value chain or indirect emissions. It's basically everything else. So there are 15 categories of scope 3 emissions. You can see some of them in this infographic, disposal of waste, procurement, pharmaceuticals, medical devices, supplies, and commutes and travel. Note that scope 3 also includes fossil fuel investments. The healthcare sector is quite heavily invested in fossil fuels. Looking a little closer at greenhouse gas emission sources in healthcare, on the left, the image with the circle, it breaks it down a little bit more. Scope 1 is sort of that cherry colored red. You see that's, somewhat small. Scope 2, purchase sources, and then everything else is scope 3. And scope 3 is broken down a little bit. You'll note on the left, I said, healthcare generates a lot of waste, about 14,000 tons a day, but actually waste does not contribute a lot to healthcare emissions, 0.56%. You'll notice that, purchased goods and services is a huge chunk, if we talked about, and you'll also see that investments make up a significant portion of scope 3 emissions. Looking at the image on the right, this is from the Eckelman and Sherman paper. They break down the scope 3 emissions even more, the supply chain emissions. And you'll see that pharmaceuticals really make up a big portion of those supply chain emissions. And I like to share this with audiences that include practicing clinicians, because I think we as prescribers can have impact in reducing, pharmaceutical overuse and ultimately pharmaceutical associated emissions. Jody Sherman and Matt Eckelman in their research also found that the single largest factor driving healthcare emissions is clinical care, which really is no surprise. I like to again share this infographic and talk about how we as clinicians really can have impact in this scope 3 category. Again, we could look at our pharmaceutical prescribing practices. Does someone really need a pharmaceutical, or could they use a non-pharmaceutical treatment? Should we limit quantities and refills? We can look at our clinical decisions through a climate lens, and how we use and dispose of devices. If we have a choice between, say, a reusable medical device or a single-use disposable, we might want to choose the reusable, which research has shown has a less impact. So I think we do have this opportunity to work within the scope 3 space and have an impact in reducing those emissions. So what do we do about all this? I know it's very overwhelming, and it's hard to know where to start. But as I said before, we have the tools and resources to do this, and opportunities for all these different to reduce emissions from all these different impact areas. So again, I'm going to repeat what I said before from the IPCC report, that we have the tools and know-how to do this, including in the healthcare sector, and we have options to have emissions by 2030, which is really a critical period of time. So how do we get this done? I work for the Healthcare Without Harm Climate and Health Program. We support the healthcare sector in a 3-pillar strategy: mitigation, resilience, and leadership. Supporting health facilities in reducing emissions, reducing their climate footprint, preparing facilities for climate impacts and building community resilience, and also leveraging and mobilizing healthcare's influence. Healthcare has significant ethical, economic, and political influence, and we really have an opportunity to move climate policies. Healthcare is the largest industry in the US. We're a significant percentage of the GDP, which gives us purchasing power. We're often, largest employers in the state, which gives us some political power. Our large supply chain gives us political power, and as anchor institutions, we also have political influence, and we have ethical influence. We're trusted, and our sector has a healing mission. So we do this in a number of ways. One of the ways we do it is we have convened the Healthcare Climate Council, which is a leadership body of US healthcare systems that are leaders in this space, and have made a commitment to drive transformation to climate smart healthcare through mitigation, resilience, and leadership. The Healthcare Climate serves as an incubator. They mentor other hospitals. They innovate and develop solutions, which they share with other facilities. And they also advocate for climate smart policies at the local, state, and federal level. I said earlier that our organizational priority right now is climate smart healthcare, and that crosses all our different program areas. All our program areas have this focus. We work very closely with our healthy food and healthcare program, working with hospitals to reduce meat and procure more plant-based and sustainable options, to reduce food waste, and to purchase sustainable, food serviceware such as, compostables. Our primary focus is on supporting facilities and serving less meat and more vegetables. We do that through our Cool Food Pledge, which is an initiative open to healthcare facilities, along with other institutions who commit to serve less meat and more plants as a way to help decrease food-related healthcare emissions. We also offer work with our supply chain procurement team, offer a lot of resources for facilities to purchase environmentally preferable supplies, supplies that have been vetted and generate less waste and generate less emissions. We have Green Health Exchange, which is a group purchasing organization that hospitals can procure through and purchase supplies that have been vetted to be environmentally preferable, and we have a Green Health approved label. We also do this through Practice Green Health, which is our US-based membership organization. We have about 1,400 facility members. We have in Arizona, I checked, Honor Health is a member, and that is the only standalone health system or hospital that I'm aware of. We do have other facilities that are part of larger systems, such as Dignity Health and Mayo Clinic. But I think this presents a great opportunity for you to try to engage Arizona hospitals in joining Practice Green Health or making some sort of a commitment to sustainable healthcare. A large part of my job is supporting. I primarily support physicians, but we have other people who can provide support if you want to make the pitch to your leadership, or if you'd like me to share my talking points to support you in doing that. I want to share that the business case for climate smart healthcare is very strong, and I think it's important to know that in your communications, especially your communications with your leadership. Not only can a commitment to sustainable healthcare lead to increased employee engagement, retention, and recruitment, but it can yield cost savings. The perception is that sustainable healthcare is expensive, but the reverse is actually true. This is data from our 2018 award application, which is a data-driven application where we looked at cost savings from hospitals that implemented these strategies. And that year found on average hospitals saved over $1 million a year, with a lot of those savings coming from the OR. So the business case for resilient, sustainable healthcare is very strong. It's particularly strong in the OR. I want to share a couple of reasons for hope. For years, there has not been a lot of high-level action, but there's a lot of momentum around sustainable healthcare. The National Academy of Medicine has convened the Action Collaborative on Decarbonizing the Healthcare Sector, with leaders across the healthcare system committed to reducing healthcare's climate footprint and creating resilience, with leaders from JACO and the American Hospital Association, AMA, CMS, the Joint Commission. So we expect to see some action of that. The Biden administration committed the United States to the COP26 health program, committing the U.S. healthcare sector to decrease emissions and build resilience. And some of you may know that HHS launched the health sector climate change last Earth Day, and asked hospitals and other health organizations to sign a voluntary pledge committing to greenhouse gas reduction and resilience. As of last Thursday, 102 health organizations have signed, committed to do this, including 837 hospitals. Briefly, the Agency for Healthcare Research and Quality recently launched a primer to help facilities decarbonize, which include measures and strategies in 6 areas: energy, transportation, anesthetic gases, pharmaceuticals, medical devices, and food. So again, a free resource worth checking out. We also are committed to clinician engagement. We know that clinicians are trusted, can have influence, with patients, colleagues, and administrators. Increasingly, medical societies are coming out with policy and position statements, recognizing the intersection between climate and health, and calling on health professionals to lead action to reduce healthcare's impact. And as I said before, we know that clinical care has a big impact. We engage clinicians in several ways. One is through our Nurses Climate Challenge, and I lead the Healthcare Without Harm Physician Network, which is a national network of physicians and medical students interested in advancing sustainable climate smart healthcare. So I encourage any of you to check it out. So I want to end with where we started, which is really about what the goal is. Again, to prevent the most catastrophic impacts of climate change, the healthcare sector needs to do its part and reduce emissions by 50% by 2030 and achieve net zero emissions by 2050. However, we are not on course to do that. If healthcare continues on a business as usual path, healthcare emissions are actually expected to triple by 2050. In our global roadmap for healthcare decarbonization, we outlined 7 high impact actions which will help the healthcare sector decarbonize. along with some other what are called bridging the admission gap recommendations, which include things like maximizing telehealth and really establishing disease prevention as climate change prevention, keeping people healthy to reduce healthcare utilization. So how can health professionals take action? You can start within the four walls of your facility, ask your leadership to make a commitment to sustainability, lead a departmental project, or do a QI project, start a departmental team. You can look at your clinical practice through a climate lens and make environmentally preferable decisions. There's a huge need for additional healthcare emissions research to better understand healthcare's impact, so we know where to focus interventions, and to provide data for health professionals to make evidence-based, environmentally preferable decisions. You can communicate the imperative for health sector to decarbonize through engaging with the media by writing blogs, giving interviews, participating in podcasts. You can include content about climate smart healthcare in educational programs such as grand rounds, conferences, other presentations, and also incorporate into health professional and training curriculum and advocate for policies that support the transition to net zero healthcare. So I know I'm just about out of time. I know this is overwhelming. So, and it's hard to know where to start, but I think, a way to start is to get educated. Check out our websites, read some of the literature. Again, happy to share any of this with you. Get familiarized with healthcare's impact, the opportunities, the language. Sign up for one of our newsletters. I offer a physician newsletter. Connect with the sustainability community. If you're a nurse, join the Nurses Climate Challenge. If you're a physician or medical student, I welcome you to join our free no obligation physician network. When you're in a healthcare setting as a visitor, a patient, or a provider, look around for impacts and opportunities. I guarantee you that once you start seeing them, you're not going to stop seeing them. They're everywhere. I think one of the most important things you can do is talk about this. With your family, with your doctor, with your colleagues, with your patients, in presentations, really just to raise awareness and commit to one action. I'll just close by saying that never think that one action isn't going to lead to something bigger. When my story started because one teacher read one classroom a story about climate change, which inspired one little boy, and he was able to inspire his mom. And then I was able to inspire my CEO, and it sort of led to this physician movement and this new job I have. So, never think that by starting small and with one thing, it's not going to lead to something bigger. So with that, I will end. Thank you so much. And please don't hesitate to reach out to me if you have any questions or if you need support in, developing your talking points, if you want my talking points, if you want help communicating the importance of doing this to your leadership.
Thank you, Dr. Collins. That was beyond inspiring. I'd say it's galvanizing. And I love that you brought us from that fourth grade waiting parking lot, probably, through 44,000 different institutions across the world. It's really been exciting to the point where I'm barely able to sit still.
That's why I love people who are interested in this, because we all get this and speak the same language and have the same values and priorities. Yeah.
So while we're waiting for other people to put their questions in, either raise your hand, put them in the chat. I had a question that maybe you can help us with, and it's not a simple answer, but maybe you can give us a few little bits. Rhonda has been amazing at bringing all of us together with Brian, just disparate people in disparate parts of life doing our own little thing. And she's brought us together in this conference, but also outside this conference. how can we learn from your experiences and just keep going so that we can have the impact that we need to have? I know you gave us some advice and some resources, but when maybe you could more specifically, when we hit a roadblock or when we feel overwhelmed, what did you do that allowed you to continue and to move forward in those instances?
Yeah, I mean, it's a great question. I do this work because I can't stop doing it. I'm very passionate about it. In many ways, it doesn't feel like work to me. And in many ways, it's my wellness. And I'm just very driven to do this. Even though it's probably time for me to stop working, I really can't. I think it really helped me having mission-based work in addition to clinical work. I think it helped me avoid burnout. For a long time, I left clinical medicine, but not because I was burnt out, because I think there was better use of me and more important work for me to do. I think what keeps me going is the people. The people who are doing this work are what inspire me. And again, we're very connected. We're a tight group. We understand each other. We speak the same language. We have the same values and priorities. We support each other. And I get my inspiration from the people. They're really my people. So I think that's what keeps me going. And, and I do this for my son.
Right. Right. I think a lot of us are doing it for our sons. And I think my son's the same age and had the same compelling.
Yeah.
Vivian Wong has asked, are there medical schools currently that are building curriculum around this topic? I never got any of this in med school or residency.
No, I didn't get any of this either. So there are medical schools who are incorporating education about the intersection between climate, health, and sometimes healthcare into curriculum. It's being done in different ways. There are a handful of schools that have officially incorporated it into the curriculum. There are also a lot of medical students who are taking the lead on curriculum development themselves. And having, developing elective courses or after or hours courses. I would say that the majority of, curriculum that I am familiar with, the primary focus is on the health impacts of climate change. I think it's important to have a broader curriculum and also include impact, content about healthcare's contribution, opportunities to reduce the impact, and also resilience. It's starting, in both health professional schools and in some residency programs, but it's not broadly integrated by any means.
Great. Rhonda, were you going to say something?
Yeah, I would like to ask you if we're going to start trying to do something here in Arizona, and I know we have at least 10 people that expressed that interest that have joined our organization. I'm sure you've inspired some more today. What would you suggest as how to get started? What should we start with?
If you're going to lead a campaign about encouraging health facilities in Arizona to take action,
yes.
I think I would go back to, the framework I shared before, get educated, develop your talking points, find out what's already going on in the healthcare sector, in Arizona. Are there any hospitals who are doing things that we don't know about? Learn about the different impacts and opportunities, and connect again with the sustainability community to, keep updated on the opportunities, to familiarize yourself with the language and opportunities. I think it's really important to really define what your ask is. are you going to ask Arizona facilities to sign the HHS pledge? It's not currently open right now for signatures, but I'm just sharing that as an example. Are you going to ask them to join Practice Green Health? Are you going to ask them to publicly, state a greenhouse gas reduction goal? I think it's really important to figure out what your ask is. In addition to really being clear about your messaging. I would also suggest that you connect with other state clinician climate action groups that are doing the same. I know there's currently a campaign in New Hampshire, New Jersey, Michigan is forming one, and probably several others I'm not thinking about right now. Pennsylvania. Which are in New York. I knew I would think of others, which are state CCAs with a focus on healthcare decarbonization, and I can connect you with them so you don't have to reinvent the wheel.
Very helpful. Thank you so much.
Great. And then we have another question from Felicia French, who said, sadly, most CEOs and hospital boards only care about profit. Do you have more data on how much reusable medical supplies and equipments will save and whether they're safe to use?
Yes, we do. That could be an entire, course. But we do have data, and there has been research about reprocessed medical devices. So reprocessing is where a medical device that is labeled as single use is, instead of being disposed after that use, it is sent to a third party reprocessor, refurbished, disinfected, and then purchased back by the facility. There is data about efficacy and safety. It's FDA regulated. And there also is, research, comparing reusable versus disposable devices. Along with cost savings too. I mean, we track that through Healthcare Without Harm. But, happy to try to dig up some of that and share it with you.
Great, thank you. And in the remaining 3 minutes, it looks like we have one other question from Nicholas Hallbaker. In Flagstaff, where I live and work, the hospital is proposing closing the current facility and building a new hospital in a different location. They claim a new facility will have much lower emissions and will overall be more efficient. I've had a hard time believing that clear cutting a forest, constructing new building with enormous amounts of concrete, steel, asphalt, etc., will do that. Do you have any information on what would be more environmentally sensible, updating an old building or constructing a new facility?
I think it's case by case. I think it's a hard question to answer, not knowing all the details. I could certainly share with you some building resources. I think in brief, I don't have enough information. I think we would need data to do a comparison, which obviously we don't have access to right now.
Yeah, that makes sense. It'd be interesting if we had access to something like a metric. So return on investment, cost, benefit, risk, benefit ratios that we use in medical determinations and decisions.
Yeah. I mean, absolutely. We need more data. That's why, I mentioned, one of the ways that I encourage people to engage is through research, because we do not have the data and metrics that we need.
Yeah,
I think we're gonna see more. There are some initiatives, including a research initiative through a partnership with the Institute for Healthcare Improvement, and I think we're going to see more research and more metrics. But there's definitely a research gap right now.
Yeah. Great. And it is almost 1 o'clock. We have a 5-minute break. Dr. Collins, thank you again so much. And the participants, thanks so much for being engaged and for giving us your time. The recording is going to end now. We're going to have this 5-minute break and we'll come back at 1:05. Thanks, guys.
Thank you. And please don't hesitate to reach out.
Thanks so much.